Hello. Thank you for having us here today. It is my great honor to be here to listen to the stories that I've heard this morning, to be asked to speak, to share our lessons learned, any advice that we could give. I had to step back and really think for a little while. I've been with the Alaska Native Health Board. I started as a volunteer when I was 15 years old, and it started with watching my mother. She was working a long week of 8 hours, or 8 to 8 negotiations. And I said, "What are you doing, Mom?" She said, "I work for Tribal Health Advocacy." I said, "What is that?" And she said, "It's the Alaska Native Services." I said, "What is that?" She said, "We're trying to take control over our hospital from the government." And I thought, what is that? And she said, "You know, you're going to have to sit and spend some time with us to know what that means." And so I started volunteering there. Thank goodness at the time the president and CEO was Paul Sherry, who is from the Tanana region. His wife is from there. And he allowed me to come in every day after school and read through the books and learn what tribal health advocacy is. And so from there, I got hooked, and I thought, wow, taking over our healthcare system, this is a real big deal. This means that my people are caring for our people all the way through. Who better to protect us, to care for us, than our own people? And when I heard this morning that you guys are on the cusp of figuring out, do you want to do this or not? I heard from someone next to me that change is good. Change is scary. It's anything that's worth fighting for is hard work. So what I have to say to you is I would do it. It's really important because when you can provide your own health care culturally in an appropriate way in your own settings and have a voice to how that's going to be done, you get a strong sense of pride. It gives you a really good feeling. I work really hard every day, and I never mind because I know that what I'm doing is to continue the healthcare services that we're providing to our people for my children, and their children. When I think about, at the end of the day, gosh, is this really where I'm supposed to be? I think about my grandmother. I think about all of my relatives who live in a community that still does not have running water. And I think, absolutely, this is what I'm here for. This is not about me. This is about the journey of ensuring our tribal health care system is sustained. Good afternoon. I'm Lanie Fox, the President and CEO of the Alaska Native Health Board. At my side is Andrew Jimmie. He is the Minto Village Council Chief representing the Yukon-Tanana subregion. He has been a board member of the Doyon Corporation since 2005, is the president of the Tanana Chiefs Conference Regional Health Board, and he is also the vice chair of the board of directors to the Alaska Native Health Board and the Alaska Native Tribal Health Consortium. I am the daughter of Lester Aniskit from Metlakatla, which is the southeast coastal area of Alaska. My mother is Rita Jones from Koyukuk, which is the interior of Alaska. I am full-blooded Alaska Native. I am half Athabascan, Tlingit, Tsimshian, Haida. My husband is Christopher Fox. His family is from Point Lay in the northern region of Alaska. He is a Inupiaq. Together we have a daughter named Skylar Mattia. So if you put all of that together, she is Athabascan, Tlingit, Tsimshian, Haida, and Inupiaq. So if we're blessed and she marries an Aleut Yupik, we can say we represent Alaska Native tribes. So I talked about how I got started in tribal health advocacy. I really believe that's where my heart is at, and I strongly encourage you to take the journey of taking over your own healthcare system, Today I was asked to speak about the Alaska Native Health Board, our role with the tribal health system, how we develop consensus, and how we establish our statewide priorities. Once I'm through with that, I'll give you a quick video of a visual of everything that I'm talking about, and then Andrew will go into his lessons learned through his many years of tribal health advocacy. The Alaska Native Health Board, is otherwise known as ANHB, was established in 1968 to assist the Indian Health Service in communicating with tribes. Our purpose was to secure the voice and participation of Alaska's Eskimos, Indians, Aleuts in the decision and development and implementation of healthcare practices in Alaska. ANHB is a 25 board member entity consisting of one elected or selected representative of Alaska Native Regional Health Organizations, independent tribal public law 93-638 compactors contractors. Collectively, these tribal leaders represent 229 federally recognized tribes of Alaska. The Alaska Native Health Board membership is a tri-part governing body consisting of the Association of Tribal Health Directors, which are typically the president and CEOs of the regional health corporations, the Board of Directors, which is typically the chair, and the alternates, which is normally the vice chair of the regional health organizations. The idea behind having the health directors, board of directors, and alternates was that when we made statewide decisions, we had the full authority of each regional corporation at the time. We also work with the Alaska Tribal Health Compact, otherwise known as co-signers or compactors. They are authorized to negotiate directly with the Secretary of Human Services, whom is represented by the Director of Indian Health Service. The Alaska Tribal Health Compact was entered into under Title V, which authorizes compacts and funding agreements between governing bodies participating in tribal governments. The Alaska Tribal Compact reflects the unique tribal cooperation that has developed in Alaska to assure that Alaska Native people have access to a comprehensive, integrated, and tribally controlled health care system. The Alaska Native Health Board's organization was created to promote the spiritual, physical, mental, social, and cultural well-being and pride of Alaska Native people. We provide advice and consult with Alaska Native people on problems and issues identified by ANHB for the Indian Health Service or the Alaska Area Indian Health Service to take action on. Through our established network, we consist of the Alaska Tribal Health Compact co-signers and our membership. We prepare analytical reports on topics related to Indian health policy, existing programs or services that are proposed to change in terms of the regulations, or anything that can potentially impact the tribal health system financially. We provide a minimum of 6 statewide forums annually. We maintain a repository of information for all of the tribes. We disseminate a current activities report on a weekly basis to all the tribes and tribal health organizations. Those reports consist of funding opportunities, meetings of importance with national representatives, tribal caucuses, policies that may impact the health system, and sometimes celebrations of things going on in our regional communities. Like Norton Sound Health Corporation, for example, is getting ready to open rebuild their new healthcare facility, which will open in November of 2012. I'll show you that video a little bit later. In addition to coordinating the tribal participation in statewide or national meetings of significance, we also provide resource and information excuse me. I can just really hear myself. For public policy and private, we also provide resource and referral information for various public and private agencies involved with services related to the Alaska Tribal Health System. In collaboration with the Alaska Area Office, we are the mechanism to consult with Alaska Native tribes and tribal organizations, and we prepare the tribes for the consultation. We have 4 quarterly meetings, which consist of the governing body that I spoke about earlier, our membership. Those meetings are held 4 times a year, the first one being in February. We hold that one in our state capital of Juneau, which allows our membership to interact directly with our constituents, the lawmakers. We also host receptions or other opportunities for our tribal membership to network directly with the lawmakers. We also host a May meeting for negotiations, which is the compact. That is the bodies that are authorized to negotiate directly with IHS. During those meetings, we have pre and final negotiations. During pre-negotiations, we discuss the issues that impact all of the tribes and things that IHS needs to be prepared for. Final negotiations is the point where we have already gone through all of the common language issues, and then we begin to anything that comes in between, we hash those out, and then we begin individual funding agreements. This is a really huge success for the Alaska tribes, to be able to negotiate directly with the government on behalf of our own people for the services that we provide for them. We have since then streamlined our services in terms of we have sidebar agreements, which is called our tribal caucus, where we all together agree on the issues that we're going to discuss, come to consensus, which our established consensus is everyone, if need be, -1, which means that if we have an issue that's on the table and we all agree to it but one opposes, then we still have consensus. If we have more than one that opposes to the issue, then we ask the opposer to present a proposal that will work for them, and then we go through the whole process again of agreeing to or establishing an agreement for each other until we come to consensus. These meetings were typically held from 8 a.m. to 8 p.m., but when I first started at the age of 15, those meetings easily went till 6 a.m. in the morning. Because when you're talking about people's money and you're protecting your tribes, you take that pretty seriously. And if it's going to be negative to you, you have your people you're standing there for, so you're going to fight to the very end. Thankfully, through time, we've become better friends. And we've learned to share and really understand each other. What's helped us really understand each other is through our quarterly meetings. We have the second day, which is for regional corporations to share what's going on within their tribes. Having that understanding of what each other is going through allows us to be a little more forgiving when it comes down to funding agreements. Thankfully, in this last year, we had a proposition on the table that we no longer go from 8 a.m. to 8 p.m. We've finally gotten to the point, some 35 years later, where we can do 8 a.m., lunch break, be over by 6 p.m. I have a staff of 4. We're a small agency doing big things, and it's our responsibility to coordinate all of these meetings together, which means being there early and staying everything through. I strongly recommend that if you take this path, that you find an unbiased body similar to the Alaska Native Health Board, perhaps you already have that established, that can take all that information in for you, synthesize it, and present it in a manner that will be agreeable to the majority. So the first day, I need to step back a little bit, of our membership meetings, the first day is typically where our membership is the Association of Tribal Health Directors. They are the technical advisors to our governing body. And those tribal health directors, like I said, was the president and CEOs of the regional health corporations. They work through health issues that impact everyone. They also work directly with the Department of Health and Human Services through the state of Alaska. We also work with the Alaska area office, and they in turn make recommendations. We have subcommittees that are impacting everyone. So the Medicaid services, telemedicine, all of those all have subcommittees. If they have actions that need to come forward, they come to the tribal health directors. From that, they make recommendations to our board of directors, which is our second day, and that's a joint meeting of the tribal health directors and the board of directors. At that point, we share our regional corporation meetings, and we move forward with consensus. Excuse me. So we have the two mega meetings, the quarterly meetings, and the compact. So on an annual basis, we host a minimum of 6 meetings per year. Those 6 meetings are the compact and the quarterly, and then anything else with the national organization, for example, Region 10, which is our Department of Health and Human Services, they may request a tribal consultation with our tribes. We are that governing body that they come to. We disseminate all of that information to the tribes. We identify a date that will coincide with any one of our 6 meetings to cut down travel costs. We also have a pre-meeting before the consultation, which is our tribal caucus. We identify the issues that the tribal consultation is to discuss, come to consensus, provide those recommendations at the time of the consultation. At that point, that has led to some of our greatest successes in terms of our relationship with national agencies like the National Indian Health Board, Department of Health and Human Services, as I mentioned. We also have huge impacts with HRSA and SAMHSA. The Alaska Tribal Health Compact is a legal agreement for the tribes with Indian Health Services and the 25 nonprofit Native Health Service entities. That outlines the authority, accountability, and fiscal responsibility for each party to carry out the health services for Native beneficiaries in Alaska. The 25 tribal health entities have signed onto the compact and are referred to as co-signers or compactors. This process is authorized through Title V of Public Law 93-638 of the Indian Self-Determination and Education Act. As I mentioned earlier, pre-negotiations is held annually to discuss the health compact issues that need to be addressed during final negotiations with the Indian Health Services. We utilize what we call an open items list. It is disseminated during pre and final negotiations to review the ongoing issues from years past and new open items during the current year. It's a matrix formatted living document that tracks the status of the compact and funding agreements related issues. Tribal leaders meet privately in tribal caucus forums to discuss strategy and common language and funding agreement negotiations. During final negotiations, the common language issues are negotiated first with IHS. Upon conclusion of the common language negotiations, individual funding agreement negotiations begin. The individual funding agreements represents each compact co-signer with legal agreement to carry out health services to Native beneficiaries in their operating unit. The Alaskan, I would be the facilitator of those meetings or tribal caucus. However, we have since established a tribal liaison who has taken over those responsibilities. IHS has opportunity to call an agency caucus at any point during our negotiations. Each item is negotiated until conclusion. In the event that a compromise cannot be made, an IHS ratifier is called upon. As needed, we also host the tribal caucus on occasion. Leaders will call for a special tribal caucus to be scheduled. These are generally conveyed to discuss items needed during urgent attention, such as national policy or funding, or to discuss an intrastate distribution of funding that has been appropriated or allocated to Alaska. To develop consensus, we identify common issues that will impact the Alaska tribal health care system as a whole, present the issue and facilitate tribal discussion, and establish recommendations for our priorities or negotiations. We recognize that one size does not fit all, so we have adopted the everyone minus one rule, which I spoke of earlier. To give you a visual perspective of everything that I've loosely run over, I felt for us, we are visual learners. I have brought a video of Norton Sound Health Corporation looking for Davis.
And
Yes.
safety.
That will better convey how we operate as a system.
Western healthcare got its start in the Bering Strait region June 10, 1902, when 4 women from the Sisters of Providence arrived in Nome on a mission of caring. The Catholic sisters made the journey at the invitation of 2 Roman Catholic priests who had arrived the year before, following the thousands who came to Nome dreaming of making an easy fortune in gold. Once settled in Nome, the sisters purchased a 2-story building and established the Holy Cross Hospital. By 1906, the hospital had outgrown its location and a second Holy Cross Hospital was built. A decade later, the mining industry was collapsing and the sisters from Nome joined the sisters in Fairbanks. Holy Cross was closed in Nome in 1917 and a branch of the Methodist Church took over and operated the facility for the next 29 years. After a fire destroyed the Holy Cross Hospital in 1948, the current hospital was built using a $70,500 gift the city of Nome received from a local man named Joseph McDougall. An arm of the Methodist Church continued to operate the Maynard McDougall Memorial Hospital until 1970, when Norton Sound Health Corporation took over its management. The nonprofit tribal health organization of 20 Native communities was founded in 1970 to address the health needs of Native people in the region. The Federal Office of Economic Opportunity funded the Tribal Health Consortium as a demonstration project to study the viability of consumer direct healthcare delivery and to develop indigenous healthcare providers. It was the Alaska Federation of Natives, AFN, that employed the first Nome-based staff for the Health Right Project, renamed Norton Sound Health Corporation, and its staff did all the work to pull the first board of directors together. Originally, health aides functioned as volunteers using the schools for radio communication. The board initiated health aid training in the villages, and by 1973 a curriculum was developed that was accepted by the University of Alaska. Also hired were 3 family service representatives who were assigned the task of delivering counseling services to the villages. Direct physician services came in 1974 when Norton Sound was the first corporation to take major responsibility for the actual delivery of medical services rather than coordination and facilitation. In early 1975, Norton Sound became the first regional health corporation to break away from AFN to become completely independent in its contract dealings with the state and federal governments. The Norton Sound Health Corporation Board felt that it could compete more effectively for funding if the board negotiated directly with Indian Health Services. In the interim, a strong dental demonstration project, including a preventative program, functioned in 4 villages funded through the state of Alaska. Norton Sound had also trained home health workers and paraprofessionals to do eye refractions in all 16 communities. In 1976, the Norton Sound Health Corporation began operating the Maynard McDougall Hospital, which was renamed the Norton Sound Regional Hospital. 3 MD positions were hired through the corporation and 1 through the Maynard McDougall Hospital. The next year, Norton Sound purchased the hospital from the United Methodist Church, and in June, ground was broken to build a new hospital and renovate the existing hospital for offices and support services through an IHS grant. It was a proud time when 5 community health aides successfully completed an experimental course in basic laboratory skills and put those skills to work diagnosing problems in the village, which before had to be brought to Nome. This was a major step in bringing complete quality primary care to each community in the region. In addition, the Emergency Medical Services Program burst onto the scene and was a part of the nationwide system. Training of medical technicians and hospital personnel began. Teachers and students of several villages were also trained in first aid and safety through the creative use of puppets. The year 1980 brought about the Nome Alcohol Safety Action Program, where funds were obtained for an alcohol prevention and treatment program. This program assisted the courts in screening for problems of alcohol abuse, assignment to appropriate treatment, and monitoring that treatment. By 1984, Norton Sound was contracting with the state of Alaska to provide all health-related services within the region. This meant moving from a maintenance-level organization to one offering new services in eye care, specialty clinics, audiology, services for the developmentally disabled, physical and respiratory therapy, drug abuse services, ultrasound services, and equipment rental. Also established was an anesthesiology service in order to provide minor surgery. Expansions were also completed in the homemaker, infant learning, public health nursing, and sanitation programs. The highest standards of healthcare delivery were established by the Joint Commission on Accreditation of Hospitals. In 1985, Norton Sound Regional Hospital accomplished a major milestone and received its accreditation through the hard work of the Board of Directors and a team of dedicated staff. Two programs of tremendous importance to the region were administered by Norton Sound starting in the same year under state contracts: public health nursing and state sanitation services. This resulted in significant improvement in service delivery and effectively linking nursing services with other primary care and providing sanitation services locally rather than on an itinerant basis. Norton Sound Health Corporation was well on its way. Aimed at decreasing maternal and infant mortality by providing education and a short-term residential facility for village women, the maternal home was opened in Nome. Education sessions were also provided by the home to encourage women and their partners to learn more about pregnancy, childbirth, and parenting. Going to the other end of the spectrum of healthcare, facilities were needed for the different age groups in the region, and ground was broken in 1987 for the 15-bed elder care center to be called Koyana Care. This addition brought opportunities for our elders to receive long-term health care while remaining close for family support. During the same time, there was another remarkable advancement with the dental program. All health services were provided by our own staff, resulting in increased services to all communities and better control over resources. The Emergency Medical Services Program continued to provide training for ambulance personnel, coordination of search and rescue operations within the region, and village-based trainings to volunteers in several communities. The following year, in 1988, the Nome Volunteer Ambulance Service became a separate entity from Norton Sound and sought financial assistance from the City of Nome, while Norton Sound Health Corporation continued to provide support for transportation of village patients from the airport to the hospital. While serving the healthcare needs of the region, Norton Sound was able to realize another goal, providing employment opportunities and strengthening economic viability. In 1989, they became the largest employer in the region, as well as being named as a statewide training center for health aides. Moving forward to the 1990s, Norton Sound Health Corporation continued on the path of success, conquering challenges and expanding and offering new services. Psychiatric services became available in the region for the first time. The Native Development Internship Program selected its first intern. Community health services became a department, and videos on self-breast examination were made in Yupik and Inupiaq. The need to be better connected to our village communities became a reality when computers were placed in all the village clinics. These provided the much-needed automated data generation. Further successes to keep up with the times included a major remodel expanding radiology in the laboratory, adding examination rooms, and relocating the doctor's charting room and the outpatient nursing station. The medical staff introduced new procedures, including various video scoping techniques, allowing testing to be placed on tape and forwarded to specialists for further evaluation. Prior to this, such procedures required patients to go to Anchorage at a large inconvenience and expense to the patient. The 1990s saw many benefits to healthcare throughout the departments and programs. The laboratory moved to molecular testing and added 2 new instruments, to provide state-of-the-art coagulation, chemistry, and virology testing, a dedicated darkroom for mammography. The first radiologist was hired, and the pharmacy was able to acquire a replacement computer to fulfill its main objective, to provide better patient care. Other improvements included linen purchases, providing a more comfortable and homey setting for the patients, uniform standardization, and the purchase of spill control kits and eye wash stations. Another major transformation was changing the quality assurance approach to quality assessment, a proactive process emphasizing the renewal and change of systems. Our community villages also participated in becoming proactive and applied for and received health promotion grants through the Community Health Education Program. Additional staff was hired in the villages, ranging from a dentist and Unalakleet, village-based counselors in each village, and 3 physician assistants. The year 2000 marked 30 years of caring for Norton Sound Health Corporation, and there were many steps forward as the board resolved to meet the ever-growing need of the communities through expansion of services and construction of facilities in the region. Over the last 10 years, wide area networks were installed linking village clinics directly to the Nome-based patient information and communication systems. A new program was visible in the villages, the Mobile Adolescent Treatment Team. This team was formed to work in villages with troubled youth and their families and brought intensive outpatient services, allowing clients ages 11 to 23 to stay connected with their homes and communities while receiving treatment. The Alaska Native Tribal Health Consortium, COERIC, and Norton Sound Health Corporation all participated in assessing the clinics in the region and assisted the village communities to seek funding to improve them and construct new ones. Many staff members regularly travel to villages to treat patients. Each village has a clinic staffed by local residents trained as community health aides. These frontline primary care providers are a critical link between patients and medical staff in Nome. A physician assistant or nurse practitioner is stationed in the larger villages. The largest village, Unalakleet, has celebrated a grand opening of a sub-regional clinic to serve its own residents and those of 4 nearby villages. Norton Sound began prevention on a whole other level with the start of the Research Gokadan project. This project sought genetic links to heart disease to find ways to prevent it in the future and was just recently completed after 5 years of testing, and we look forward to seeing the findings. The camp department's mission is to empower people and communities to promote healthy lifestyles and to improve the quality of life for persons with chronic illness. CAMP has assisted many individuals to take ownership of their health care, develop culturally sensitive programs promoting healthy lifestyles to prevent chronic illness, and has been exemplary in successfully coordinating a diabetes prevention program region-wide. The hospital was able to purchase a new 16-slice Siemens CT scan machine recently. This piece of equipment was critical to patient care in the region as there was no other alternative imaging-related diagnostic services available. By having access to this important diagnostic technology, the quality of patient care for the region will improve and be enhanced in 3 ways. 1, local access to CT scans in Nome will be physically and emotionally less stressful for the patient. 2, the continuity of patient care will be improved. And 3, better tools for detection may result in earlier diagnosis of certain diseases and conditions and improve the prognosis for some. The new patient hospital in Nome provides affordable lodging for patients and their families traveling to the regional hospital for treatment. This hostel supports the existing hospital and will also support the new hospital as it is located nearby. The design work is complete and construction has begun to replace the 60-year-old structure that will consolidate various other healthcare services at sites spread across Nome. The new hospital is expected to open in 2012. As we come upon 40 years of health and education, Norton Sound Health Corporation is quickening the pace of positive change by refocusing our system to put our patients, clients, and communities first in everything we do. We have embarked on major building and renovation programs, yet our improvements do not focus only on adding facilities and expanding programs. Clear, primary emphasis is being placed on external and internal customer service throughout the region. The Norton Sound Health Corporation mission is to provide quality health services and promote wellness within our people and environment. As a corporation, we are dedicated to provide excellent patient and client services as we move toward our vision of becoming Alaska's preferred rural health system. Norton Sound Health Corporation is comprised of many departments and programs, staff and volunteers, each with their own responsibilities, and it is all of these and all of you which make quality health care possible in our region.
Thank you for 40 years of health and
So I wanted to show you the video to encourage you that this process can be difficult at times, and it's a lot of hard work, but it takes time, and it's taken the Norton Sound Health Corporation 40 years to get to where they are. It doesn't take everyone that long, but it's definitely worth fighting for health promotion, disease prevention, and quality improvement. I strongly encourage you to continue on your journey. Mr. Andrew Jimmie is going to share with you some of his lessons learned and share any potential advice that he can recognize.
Thank you, Lanie. Whenever I make a presentation like this, I always choose to go last because I don't believe in repeating anything that's been said before. My name is Andy Jimmie. I'm from a small village in the interior of Alaska, a couple hundred people. And I represent the interior 44 villages on Alaska Native Health Board. And we have another statewide organization called Alaska Tribal Health Consortium. Most of the people that on Alaska Native Health Board serve on that board, and they run the hospital, statewide hospital, and the water and sewer, and just about everything that community needs. The big hospital is in Anchorage, Alaska. I've been involved in the on the health board for a long time. I've seen a lot of changes. We have 12 regions in Alaska, and most of them have their own hospital, like Norton Sound. There's, I think, four or five regions that don't have. In my region, in the interior, we don't have our own hospital. We're leasing, we got a contract with another hospital up there. But this year we're building a new, what we call a super clinic. And that should be done in 2 years. I think I was supposed to kind of give a little advice. You heard earlier that you need vision. And I guess that's how our consortium and health board, someone had a vision to take over all our health programs. And I heard earlier too that I thought I wasn't going to get nervous. I always get nervous, but I seen a whole bunch of Indians, so I thought I'd be okay. Well, one of to make things work, I guess, is when I first started on Alaska Native Health Board, we were going to create another organization to run our statewide health program, and water and sewer mostly, because we have a lot of villages that don't have water and sewer. And it took a long time because everyone was used to doing their own thing in their own region. And it took us a long time to get united. It took one time we're just staring at each other. Everybody on one side of the table. But it took a long time to really start working with each other. To work, you know, everybody want to be the boss, you know, a lot of times. We're all like that, I don't know. But to have a good, really good program, health or anything, it'll be better if you run it yourselves, and that's what we did. And 10 years ago, 11 years ago, and it is working really good. And one thing, working like a whole bunch of regions, you got to be on the same page. You got a decision have to be made by all. If one refused to work with the rest of them, it just binds up the whole program. So it took us a long time to really work together, but now everyone is really happy that we choose to run our own programs. And it's really, really important to be united. And, I guess I heard earlier this morning that we're not strong enough to do it alone. We're not strong enough or smart enough for, oh, we are smart. But we need to, you need to unite. You have to be all, if we do it all together, anything that we ever did with everybody on the same page works, always worked. And you got to do it yourself. You know how we all are. It's not good unless you do it yourself. So I think it's the main thing is to do a lot of planning. It takes a lot of work, and hang in there. I mean, many times I tell myself, what am I doing here? But now I can see, because I'll never see the end results. It's from my children, my grandchildren, great-grandchildren. And that's what keeps me going. And if we all work toward that goal for our grandkids, we'll get it done. And I am really honored to be here. The chairman, Lincoln Bean, sorry he couldn't make it. He's got other commitments. And that again, before I left, I say, why me? But I'm happy to be here. I really am. And I want to encourage you just to work toward your goal, and I appreciate everything. And thank you very much.
Real quickly, our shared goal is that Alaska Native people will be the healthiest people in the world, and so we're always striving for that. Thank you.